Drug overdose deaths, sadly, are setting records in the U.S. amid this pandemic.
The nation's opioid crisis has become even more deadly during the pandemic, with a record 81,000 people overdosing during lockdown.
It's a problem that has only gotten worse during the pandemic. Drug overdoses skyrocketing.
According to the CDC, more than 94,000 people died nationwide due to opioid overdose in 2020. That's a 30% increase over 2019, and the highest number of overdose-related deaths ever recorded.
For more than a year now, time, money, and resources that normally would have been used for the opioid epidemic has been shifted to help solve the COVID pandemic. Now, Tapestry has been affected by this, but they've made adjustments to increase their outreach, including telehealth, but they've seen firsthand the devastating impact the isolation has had on people with substance use disorders.
Between May and the end of July, more than 500 people in BC have died of overdoses. The social implications of COVID-19 are one likely factor. Physical distancing means some safe consumption sites have had to shut down or reduce their space, and more people are using alone. Another cause, increasingly toxic drugs. Experts speculate border closures have disrupted the supply, leading some to concoct mixtures with additional chemicals.
The early days of COVID left many opioid addiction patients facing closed treatment centers, cancellation of in-person recovery meetings, or difficulty accessing opioid use disorder medications. In 2019, pre-pandemic death rates grew by 4.9% to over 71,000 deaths, with illicitly manufactured fentanyl continuing to drive the increase. The American Medical Association says at least 30 states have reported overdose deaths rising in 2020. And a recent analysis of 500,000 drug tests showed a 32% increase for non-prescribed fentanyl from mid-March through May. Suspected drug overdoses climbed 18% in that same period.
The CDC recommends public health departments and community-based organizations to 1. Expand the use of Narcan, a medication designed to reverse an opioid overdose. 2. Teach people about overdose prevention. 3. Bring awareness to treatment. And 4. Intervene early with people at highest risk for overdose.